Hi, I'm May, and our group for this project, we're going to be talking about osteomyelitis. My group members include Jennifer, Ben, Tonian, and Deja. And together, we're the osteomyelitis group. Yay! So I guess like before we get started, you're probably wondering like osteomyelitis, what is that? So what makes it easier for me to try to comprehend is the prefix osteo is actually a Greek prefix and it means bone. And myelitis is like inflammation. So you know anything itis is inflammation like in the healthcare. So myelitis is basically inflammation of like surrounding tissue, fatty tissues. So together we're gonna do, or the meaning is inflammation of a tissue into a bone, right? Perfect. So you're probably wondering, you know, like, can I develop this disease? Or, you know, most people think I'm untouchable, I can't catch anything, but with this one specifically, it targets everybody. There's not one group that's, oh, I'm too young, I'm too old. It literally targets everybody. As you can see, if you're African American female, you could get it, elderly, like late middle age, early, late age, you know what I'm trying to say. But yeah, you can get that, and then adolescents could get it, children could get it. So it's a disease that, you know, can affect anybody at any time in their life. But for this purpose, or for this, it's more common for like the elderly people to catch it, and by elderly, like anybody over 65. So with that being said, as I said, like if you're older, you can get it, and there's other like risk factors that will contribute to this disease. And of course, you know, smoking's bad for you no matter what you do. Like, don't smoke, it's bad. And then if you have diabetes, you know, sometimes you can't help it, but like diabetes, that's also push you more at risk as well. And then you can't stop from getting old, because you're gonna get old, we're gonna get old. So you're just trying to be as healthy as possible. And with that being said, like the disease itself, there's 3 ways to get it, right? And it's through your blood, through surgery, through injury. And anytime you have like an exposure, like an open wound that's exposed to like outside contamination, whatever, you can get it. So the best step for you to do is just, you know, like during surgeries, make sure your surgeons, they use all sterile things and they try to keep the atmosphere as clean as possible. And you'll be fine. And of course, like as you get older, some of your joints and everything, and you don't heal as fast as you did when you was younger. But you know, try to be as healthy as possible. So we're gonna move forward. And you know, like any disease, the best thing you're supposed to be doing is like go to the doctor's office. Don't wait until you're sick to go. Actually go and speak to your PCP and make sure that everything is working. So when you do have a problem, it'll be easier for you to notice, hey, I've been having a fever for like 2 weeks. Hey, I've been really tired the last month. Hey, I got a bruise and it seems like it's swelling and it's just getting worse. The more you go to your doctors, it'll be easier for you to, I guess, like observe, hey, something changed in my body, let's get this checked out. And you know, like this disease, it often takes place in the legs, the arms, or the spine. It just depends on where the wound is and where it was exposed. And pretty much that. With that being said, back to speaking with your primary care provider, you don't want to wait until it's too late, because sometimes when it's too late, it's going to be harder for you to either like get cured, get help, get better. So as soon as you notice that something changed, go and speak to somebody, because it's easier for you to get help on the disease. So with that being said, of course, when you talk to your PCP, the first thing they're gonna do is, you know, do a regular x-ray, and they'll be like, oh, okay, well maybe this person might have osteomyelitis, let's do some further testing. And of course, like with the further testing, you would be, you know, it's easier for you to get help. And like this disease, you can actually get help for it. It's not like cancer where, hey, I can't get cured. Like this is, you know, speak to your healthcare provider and they'll help you. And I'm gonna pass on the floor to my next person, or my next team member, who's gonna give you a little bit more detailed about what's going next.
So I'm going to talk today primarily about how osteomyelitis affects the elderly. As May stated, they are the top risk group for getting this disease. And this specifically is going to follow a case study that was done on a 65-year-old male. So this 65-year-old male presented in the ER with type 2 diabetes. And diabetics are a top group for getting osteomyelitis due to mostly just having diabetes itself and the lifestyle that comes with developing diabetes. Because as May said as well, having a healthy lifestyle, a healthy diet, regular exercise, that does help in preventing getting this disease. So this 65-year-old male presented in the ER of type 2 diabetes and a painful ulcer on his right third toe. He had the ulcer for about a month, and he did have 104-degree fever. When he did show up at the ER, the fever had been resolved. However, he did still have a staph infection that was detected from a swab culture, and that also they also did an x-ray, and the x-ray confirmed that he did have osteomyelitis. So this is a picture of his actual foot when he came into the emergency room. This is the toe that's obviously been infected, and it has the ulcer and the osteomyelitis. So you can see how swollen it is compared to his other toes. And this is the x-ray that was taken when he presented at the ER. So this is the toe that's been infected, and you can see how swollen it is just in the x-ray. And this also shows that he has no cortical bone. So the cortical bone is the dense outer surface of the bone that forms a protective layer around the internal cavity. So you can see here how much more swollen it is compared to his other toes due to that. So when he presented, when you have osteomyelitis, there are various ways for treating it. The most popular is antibiotics. So what they gave him is gentamicin. So gentamicin works by killing bacteria or preventing the growth. So it is an IV treatment. So they hooked him up to an IV and gave him this treatment while he was in the hospital. He was released, and when he was released, he was given flucloxacillin. So this is another antibiotic, and this is used to treat skin infections, including diabetic foot infections, since he did come in with type 2 diabetes. This is an oral medication, so it is something that he could take at home. So when he was sent home with the antibiotic, which he continued to take for 12 more weeks. After 1 week, he did report pain relief from the toe that had the ulcer. At 3 months after taking the antibiotics for 12 weeks, he did follow up with his primary doctor. He was able to report complete recovery, and they did do a clinical exam on the ulcer, and it had healed, and there were no signs of the infection anymore, of the osteomyelitis. So again, this is an x-ray here showing when he first presented at the ER, and you can see again how swollen his toe was compared to the others in this image. And then this is when he presented at his doctor's office 3 months later. So there is a vast difference. You can see how using the antibiotics were able to resolve the infection. So again, antibiotics don't always work, but it is the primary one that's given when people present with osteomyelitis, when they present with this infection. So in this case, it did work for him. He was able to. In other cases, surgery is required. They would have to go in and to correct the bone. But in most cases, you can just get away with antibiotics. So yeah, just reiterating again what May had said, because this was an elderly man, he was more at risk for getting this infection. And again, because he did have diabetes, that group in itself, being elderly and having diabetes, you are at higher risk of getting osteomyelitis. So, like previously stated, just having a healthier lifestyle, getting regular exercise, all of that can really help in preventing this. And next we're gonna do another case study with Deja.
Okay, so for case study number 2, it is of a 12-year-old male. The chief complaint of the 12-year-old male was pain in the left knee. The patient was unable to move his leg or walk. He also had a fever of 104 degrees. He had no known pre-existing conditions, and when his blood work was ran, it came back showing that his white blood cells were 1,200 microliters higher than the normal range. When you think of a normal 12-year-old, you feel like they would be healthy and wouldn't have any of these symptoms on a normal day. But when doctors took an x-ray of the patient's left knee, they found that there were lytic lesions found in the top of the tibia. Lytic lesions are basically where bone density becomes less, and it creates like some sort of hole. So the patient was suspected of osteomyelitis, and instantly doctors put the child on an antibiotic therapy using amoxicillin 8 hours a day for a week. The patient left the ER but then came back, and when radiographs were taken again, you could see that the lytic lesions got larger and the patient wasn't cured of the disease itself. They did an MRI because MRIs are able to show you exactly like how much larger the lesions get, and it's an in-depth view. So originally doctors thought that it was just in the metaphyseal region, but the MRI showed that it went into the epiphyseal as well. The bone density in a normal bone would be like here and here, but then the lesions are shown with the darker spots, showing that there are holes in the bone mass. View A is a sagittal T1 weighted sequence. B is a coronal and T1 weighted sequence, and then C is a sagittal T2 sequence. After the patient's MRI came back, he was given a minimally invasive surgery where they were able to do a debridement of the bone and take cultures of the actual infected area, which came back. And it came back showing that it was positive for Salmonella non-typhodal. So since doctors were able to narrow down exactly what infection or what bacteria was causing the infection, they were able to put him on the right antibiotics and correct the osteomyelitis. For the next 2 years, doctors took an x-ray of the boy's leg in order to see if the lesions were getting smaller or not. And next one. You can see that the lesions began to get smaller and the bone mass began to get stronger, and it shows a fully recovered tibia. So the surgery and the antibiotics catered to the exact bacteria cured the boy.
So for my case study, I also did on a child. It was a 10-year-old girl that was, it was delayed diagnosis of osteomyelitis. So she had complaints in her left knee of pain. That was actually due to a trampoline accident that she encountered. So there was no sign of symptoms for osteomyelitis then. They only saw skin abrasion, so no doctor was consulted, and her pain was also subsiding. But after she went to on a school field trip, and she walked 35 kilometers, she started to feel like pressure as she was walking. So her parents got worried, and they decided to finally take her to see a medical practitioner, as well as a pediatrician and an orthopedic surgeon. But of course, they did not find anything. Once again, only thing that they found was painful leg extension. So after they did some more tests, and they saw that she had a high ASR and a high ASO, which is like normal, which is is not normal because they went over the range. So they decided to do a radiograph and a subsequent MRI. So both of the images of the radiograph showed the osteolytic lesion, which is here. That's where the bone destruction that results from like the spread of cancer in the bone. So this was actually taken 8 weeks after the first symptoms. Okay. So this is the MRI that was showing a sharply limited enhancement of the patella. So it's like really sharp around the edges, which is not what's supposed to be noticeable. So they completed more tests, and they came back where her ESR was a lot higher than the last test that they did, and the CPR, which is this inflammation in the blood. Well, they came back 5 days because like she started getting increase in pain in her knee, and they saw that there was swelling and hyperthemia as well. And this is the CT scan of the left knee that's showing a clear vision of the osteolytic process with sharp borders. So like right here, there. And this is getting to the root of the problem where she was finally diagnosed. So she was referred to a pediatric orthopedic where she was presented with swelling in her patella and of like the soft tissue area, and local hyperthemia without any other symptoms. So they did a biopsy, and the histological examination showed signs of acute osteomyelitis. So they had to remove dead tissue that was around the area, and they gave her a chain of gentamicin in the soft tissue. So it was placed there and then was removed after a few days. And for her other treatments, she was treated with intravenous like this and phosphomycin. Those are a type of antibiotics for 12 days. And she was also placed on antibiotics orally for 16 days using oxymicillin and I'm not gonna try and say it, but you know, it's right there. So for her recovery, her leg was placed in a cast, and she was discharged 17 days after hospitalization, and she was free of pain, but immobilization was, continued for another 2 weeks. This is not actually her, but it's a 10-year-old girl, so you get the idea. So her CRP and her white blood cell counts were back to its normal ranges, and then her cast was removed, and she was sent home to continue her normal activities without restrictions. And then they had a follow-up 17 months after, and she was completely symptom-free and had a full range of knee joint motion, And this is just a radiograph of like a nearly full recovery of her patella here. And yeah.
Alright, so next, we're going to be looking at some radiographs of osteomyelitis. And one thing to note is that this word here, sequestrum, this means a piece of dead bone tissue. This type of tissue will appear and occurs in diseased bone tissue or injured bone tissue that hasn't healed quite well. So you could see the sequestrum right there in this radiograph, and this word over here, involucrum. This is a thick sheath of periosteal, new bone being formed on top of the bone that's been diseased. So you can see here, this is the diseased, the dead tissue, and over here, new bone that's formed on top of it. So, next. So here we have a radiograph of the foot, and this is osteomyelitis, of course. They've been infected with the bacteria Protomyrobilus. And this is showing you the progression of healing. So they started in 2013, October of 2013, all the way to December of 2015. And as you can see, the proximal phalanx and the head of the first metatarsal are the areas of infection. You can tell over here it looks pretty infected. This was a 62-year-old male, type 2 diabetes. And this person was treated with an intravenous drip of antibiotics. They used piperacillin, and they also use ciprofloxacin. I got it. Next. All right, here we have a radiograph of the hand. This view is a little magnified over here. So this patient, they have a chronic osteomyelitis. This means that it comes and goes, and they live with it for a really long time. And as you can see, the areas of infection are the third metacarpal bone and the fourth metacarpal bone. Over here, you can see that some form of sclerosis has occurred. The cortical layer it's been thickened, and over here you can see that some bone formation was going on over there as well. This patient was also treated with some antibiotics, the intravenous of a vancomycin. This was a 40-year-old male. So next one. All right, lastly, here's a few more images of radiographs. Over here, you can see that this is a image of a patient who's in the process of recovering. They had a pretty traumatic experience. You can see that the fibula is completely broken here, and there's some bone fragments over there off the tibia, and they have a rod placed on the bone to stabilize it. And you can tell over here, this is where the infection has occurred, the osteomyelitis. Over here, this is a good example of what osteomyelitis would look like on a radiograph, because they usually look like tumors. So you can see that here on the big thumb. Now over here on this one, you can see that the bone over here has been infected, and some time has passed. They followed up with another radiograph, and you can tell that it's been healed slightly, but there's still some infection. And over here, you can see that the second metacarpal bone, the head of the second metacarpal bone, and the distal phalanges over here, proximal phalanx, have been infected. This is the area of infection right here. And that's osteomyelitis.